So you're experiencing hair loss and you're wondering what your options are. I want to make a quick video overviewing the options you have. And I'm going to talk about them in terms of most effective to least effective. The most effective means of hair loss is hair replacement. This is where we transfer healthy hairs from usually the back and sides of your head to the areas where you have hair loss. The procedure is, knock on wood, close to 100% successful and gives you a natural looking result. Number two is hair maintenance. When you're starting to notice hair loss, but your hairs are still relatively healthy, that means that they're thick, you can actually use agents to keep them healthy or maybe even revive them to some degree. There are two different categories of hair maintenance therapy. There's blockers and there's stimulants. Hair maintenance blockers are agents that block the cause of hair loss, such as in male pattern baldness. We have testosterone being the culprit. Using a blocking agent on testosterone is a great blocker. Stimulants are maintenance items that help you stimulate hair growth. These are things like Rogaine, laser caps, PRP. They're not blocking what causes hair growth, but they're actually causing stimulation. The third overall category of hair loss treatments is camoflaging. These are techniques that were used to hide the hair loss. Most people are used to seeing fibers that add bulk to the hair. However, there are also techniques such as micropigmentation, where you actually lay down pigment in the scalp to hide the contrast between your hairs and your scalp, such that it gives a visual appearance of a full head of hair. The fourth category is basic hair health. These are things you can pick up at the drugstore that have some impact on hair loss, but to a much less degree than anything we've mentioned prior to this. These things are supplements like saw palmetto, biotin, collagen, your basic vitamins, iron. And then there's hair health in terms of your shampoos and your conditioners. Just using shampoos and conditioners that are lighter on your hair, some of them that have anti-testosterone blocking agents in them to help slow the hair process down. But again, much less effective than hair replacement and hair maintenance.